team gives you a closer look at the events that happened around Maine this week.
Good morning. Thanks for joining us. I'm your host, Cindy Campbell. April is Colorectal Cancer Awareness Month, so I talked with Dr. Tyler Bernaiche of Northern Light Eastern Maine Medical Center about the importance of testing and why colonoscopy is often your best option. Dr. Bernaiche, how common is colorectal cancer?
It's relatively common. The current estimated incidence is approximately 150,000 new cases every year of new cases of colon and or rectal cancer. About 100,000 of those will be colon cancers and about 50,000 will be rectal cancers. And it's estimated that approximately 50,000 Americans die each year from colon or rectal cancers. And as far as how common that is compared to other cancers, colorectal cancer is the third most common cause of cancer death in women in the United States and the second most common cause in men.
Wow. But it is treatable, right? If it's caught early enough, it is treatable.
Yeah, that's the thing with colorectal cancer and why I love being a colorectal surgeon and doing, screenings and treating patients is that if you find polyps before they become cancer, the colorectal cancer is 100% preventable. And as long as you catch it early, it's also treatable if it's a low-grade early cancer.
So what are some of the things that can put a person at higher risk of contracting colorectal cancer?
Oh, there are a few lifestyle things as far as diet and smoking and things like that. But one of the factors that will put someone at higher risk is a family history of colon and rectal cancers, or if the patient has a history of inflammatory bowel diseases such as Crohn's or ulcerative colitis.
Okay. I think one of the scariest things I've ever read about colorectal cancer is that the most common symptom is often that you have no symptoms, correct?
That's 100% true, sure. And that's why screenings are so important. When you take a patient who has no symptoms and you screen them for colorectal cancer, you can find colorectal cancers before the patient has any idea that they're there. And unfortunately, actually, if the patient's having symptoms of colon cancer, that actually would be a sign that it's an advanced stage and is going to be more difficult to treat for a cure.
Okay.
So you want to find these before you're having any symptoms.
And what kinds of symptoms would people be looking for?
Yeah, some hints that you might be concerning for colorectal cancer would be things like change in diet tolerance, if you're just getting fuller faster or you're not able to eat like you used to do, or if you're finding there's a change in your bowel habits, such as maybe you're having a hard time passing stools or they're getting thinner or harder, or if you're having things like rectal bleeding or abdominal pain or just weight loss and not really knowing why. Those would all be kind of symptoms that there could potentially be something serious going on.
Okay. So for people who are not having symptoms, at what age should you start talking to your doctor about getting tested for colorectal cancer?
This is a great question. I think the easy answer right now would be 50 years old for asymptomatic patients, but the recommendations are changing. So right now, with the institution of colonoscopies, the rate of new cancers that are being found are actually decreasing in those over 50 years old. But the rates of new cases of colon or rectal cancers in patients under 50 years old, especially rectal cancers, that's actually been going up every single year.
Wow.
And so now there are some change in guidelines. The American Cancer Society is recommending that patients get screened at 45 years old. And these are patients at average risk. So patients who have a family history, so, a mom or dad or brother or sister with colon or rectal cancers, they should be screened at 40 years old or 10 years earlier than the age when their relative was found. Also, patients who have family history of polyps will change the timing that they should be screened as well.
Okay. You mentioned colonoscopy. I think that's probably the most well-known test for colorectal cancer. I just had one not too long ago, and it really isn't as intimidating as a lot of people think it is it?
Yeah, no, I would agree. I think the big thing that patients don't like is the prep.
Yeah.
You do need to have the colon completely cleaned out in order for us to be able to get a good look on the inside. And so that is a night of kind of passing a lot of stools and things like that, and that's the worst of it. But when you actually come in for the colonoscopy, we put patients asleep. They don't remember the procedure at all. We're using different types of gases and things that dissipate really quickly, so patients will wake up really with no, if minimal, symptoms from the colonoscopy, and a lot of times they'll kind of ask us when they're going to go back for the colonoscopy because they don't remember it all.
I will say I have had experiences in the past. Versed used to make me sick. And so going to have another one was intimidating to me. And I found out that they've changed the drugs that they give you, and I didn't have any side effects at all. I felt great when I woke up.
That's great. That's great to hear. Yeah, we have different options now. Versed is being used sort of less, at least in my experience, where we're doing our colonoscopies. And there are other medicines we can give, too, to help with nausea from anesthesia, like patches and things like that. So as long as the anesthesia team is aware of things, there are other things we can try to kind of alleviate any of those kind of problems.
Okay. Awesome. Important to just mention that if it's something that's bothered you in the past.
Correct. Yeah. Mm-hmm.
Colonoscopy is not the only way that you can detect colorectal cancer, right? What are some of the other screenings that can be done?
Sure. Yeah. There are a bunch of different ways you can kind of screen for colon and rectal cancers. One of the more common ones that people know about is the Cologuard test, where it's a stool sample. And then from that, they put you into, whether or not there's concern there that there could potentially be cancer in the colon. Other options are a CT scan, where you go in and they kind of fill your colon full of air, and we'll take a look with the CT scan to see if they can find polyps there, as well as other kind of tests that just look for blood in the stool. I'm a huge proponent of colonoscopy. I think that's definitely the screening modality of choice for me. Some of the issues with the other tests are, for instance, for the CT screening, you still have to do the bowel prep before you come in for the CT scan. Okay. The CT scan is not going to find smaller polyps. It's only better for, essentially polyps that are over a centimeter, and those are the highest risk polyps. And then if the CT scan does find something, then the patient would need to come back on a different day to re-prep their colon and then have a colonoscopy at that point.
Right.
Versus the colonoscopy is a, one-stop shop. You come in, and if there are polyps, we are able to kind of take them out at that time. The problem with the Cologuard test, in my opinion, is that it's just not sensitive enough for polyps that haven't turned into cancers yet. It's pretty good at finding cancers. They'll cite a sensitivity that they'll find 92% of all cancers. Okay. But the Cologuard will only pick up 42% of polyps that haven't turned into cancer yet. And, that's the huge thing with preventing colorectal cancer is you want to find, what happens is it's not like you just have nothing and then you grow a cancer. Right. First you'll grow a polyp. I kind of think of it like a baby polyp. And then the longer that it's in the colon, the bigger it gets and the higher chance that it'll turn into a cancer. And you really want to find them before they turn into cancer, because once they've turned into cancer, then you have to worry about lymph node spread and things like that. Right. And the Cologuard test is finding less than half of those baby polyps. So while those are options, and potentially depending on, patient risk factors and I guess their, how averse they are to undergoing colonoscopy, those screenings are better than nothing. But I do think, and maybe I'm a little biased, right, because I'm a colorectal surgeon and I do colonoscopies, but I do think that colonoscopy is by and far the best screening modality.
Well, it sounds like from what you're saying, if they find anything the least bit suspicious, you're going to have a colonoscopy anyway, so it would make sense to just start there.
Correct. Yeah, that's what I would recommend, and that's what I kind of tell my friends and family too, stress the importance for colonoscopy.
Okay. I would think one of the first things people need to do in this process is to get over the embarrassment of going into the doctor and saying, hey, I'm having problems in the bathroom. That can be very embarrassing to go in and share with someone, but ultimately it could save your life, so worth a little discomfort.
Yeah, totally. And I think nobody has any issues kind of talking about things like if they find a breast lump or something. I feel like for whatever reason, that's very easy for patients to bring up that they have kind of a mass in their breast. But if they have things like pain in their rectum or rectal bleeding, yeah, they can be a little bit embarrassed by that. And unfortunately, that's leading to us seeing, I'm seeing a fair number of patients, unfortunately, in their 30s or 40s. And maybe they had some rectal bleeding, maybe they mentioned it to their doctor, maybe they didn't. And then there's a thought that maybe it's just kind of some hemorrhoids. But unfortunately, by the time they get to me, they've developed advanced rectal cancers. And I'm seeing that relatively frequently of these young patients in their 30s and 40s with advanced rectal cancers. And it's something that's very alarming to see.
Okay. So talk to your doctor and find out what's going on.
We are used to talking about things like that. So, yeah, don't be embarrassed. We're more than, if you're having bleeding or pain, just let us know.
Find more information at northernlighthealth.org/colorectal care. Next, sexual assault and human trafficking are more common in Maine than most people would think. I chatted with Jennifer Wilkie and Jess Bedard of the Maine Coalition Against Sexual Assault about how MICASA can help. So I think sometimes we get complacent living in Maine, things like leaving your doors unlocked or leaving your cars unlocked. So I think it would surprise some people to learn that sex trafficking happens in Maine, but it does, doesn't it?
Yes, it does. Human trafficking does happen in Maine, both sex and labor trafficking. And for sex trafficking, there are low-range estimates of 200 to 300 people trafficked every year. We think based on the number of people who are served by sexual assault and domestic violence providers, that number of people who've experienced sex trafficking and exploitation is actually much greater. Yeah, and people can be trafficked for labor as well as sex. Labor trafficking is happening in Maine, but people rarely talk about it.
And what is labor trafficking?
Labor trafficking is compelling someone into work, into labor, through force, fraud, or coercion. So it has a very similar definition to sex trafficking, which is compelling someone into sexualized labor, sex work, trading sex for something of value through force, fraud, and coercion. You mentioned the sort of leaving the doors unlocked. And I think, it's important to note that human trafficking, like sexual assault, is rarely perpetrated by a stranger jumping out of the bushes, kidnapping people in a van, or through home invasion. Can it happen? Sure. But most of the time, people are controlled in manipulative ways, and the victim knows their trafficker.
Who is most likely to fall victim?
So trafficking is most likely to happen to people who are already harmed by oppressive ideas like racism, transphobia, xenophobia, and who already, relatedly, lack access to basic needs. So, for example, LGBTQ plus youth are more likely to be trafficked for sex because they're more likely to be discriminated against because of their gender identity or sexual orientation and have lost their housing as a result, right? And we know that folks who have lost their housing are at greater risk of being trafficked. Kids who have interacted with the child welfare system are more likely to be trafficked for sex. We think this is in part because people who've experienced childhood trauma, particularly childhood sexual abuse, are more likely to be targeted. But also kids in the child welfare system might not have a caring adult in their lives, which is a risk factor, or they might have negative experiences with the system, and the distrust of the system that follows could create a vulnerability that traffickers can take advantage of.
Okay. Does Maine's growing drug problem play into this? Is that a contributor?
Yeah, it's an interesting question. There's no doubt that using substances creates a vulnerability for people who use them, but we also know that substance use can be an impact of the trafficking itself. Traffickers will use substances to control victims, both physically and coercively. Since using drugs is a crime, traffickers can use that information to blackmail people.
Right.
We also know that substance use can be a way for some survivors to cope with the trauma they've experienced, and that applies to trafficking and other types of trauma as well. But ultimately, trafficking is an economic crime. It doesn't happen equally to all people, and lack of access to basic needs like food, shelter, employment, and even treatment programs for folks who are using substances create opportunities for trafficking.
So are there red flags that people can watch for that might indicate someone they know is falling victim?
Yeah, we encourage community members to be aware that trafficking exists so that if someone describes their experience as being forced, coerced, or defrauded in the process of engaging in any work or sex work, that they can help that person get help. So some of the things they might listen for in conversations with folks is indications that they've been tricked or lied to about working conditions, that they are not able to keep all the money that they earn, that they don't have access to their identification documents, that they're being extorted or blackmailed, or that they aren't able to move freely in the community. And there's other risk factors, of course, as well that folks might listen for. But it's important that community members not, take it on themselves to find, investigate, and interrupt trafficking. And unless someone has shared with you that they're being tricked, manipulated, or forced, it's very difficult to know for sure that someone is being trafficked. And though it might be tempting to, play the hero, doing so can be really dangerous for you and for the person you're worried about. And like with sexual and domestic violence, you really want the focus to be on victim or survivor's needs and wishes, not on those of external folks. And like in other abusive situations, there are so many reasons that a survivor might not choose to leave that situation. It may be less safe for them to do so. They could be protecting loved ones. They could have determined that despite the harm they're experiencing, they're actually in a better situation than they would be otherwise. Or they could love or care for the people who are involved in the trafficking. Or they might just, not be ready.
Right.
So, certainly there are places where folks can listen for and be aware of trafficking so that it's not a shock if you learn or suspect that someone you know or care about is being trafficked or exploited. But we really want folks to be clear on ways they can support people without being a savior or a rescuer.
Okay, so just to clarify, if someone suspects that someone they love is possibly a victim of sex trafficking, what do they do? Is there anything they can do?
I mean, they can certainly help someone, give them access to resources. There are sexual assault helplines that folks can call to get connected to services. There's a national human trafficking hotline that connects folks back to Maine resources. The domestic violence helpline also can connect folks with immediate support. And those centers work with other community programs, like there's a case management program based out of Cumberland County. Preble Street Anti-Trafficking Services supports folks. There's a residential program for folks who are experiencing trafficking, Courage Lives. There's transitional housing programs through Sophia's House, an emergency shelter through Safe Voices. So there are certainly programs that can help support folks who are wanting to leave trafficking situations or are looking for support. There's an emergency fund through Mi Casa that can support folks getting access to their basic needs. But essentially, we advocate for these decisions to be survivor-centered and driven. And so while sometimes community members may deem that they need to call the police because there's a safety issue,
Right.
we genuinely encourage folks to let that decision be up to the survivor and up to that victim themselves, because interrupting trafficking in a way that might make sense to you might not actually make that person safe for themselves, and that folks are an expert in their own safety and their own autonomy in lives.
All right. So you're with Maine Coalition Against Sexual Assault. What kinds of resources are available through Mi Casa?
So Mi Casa supports and represents Maine's local sexual assault centers and children's advocacy centers, and sexual assault programs around the state provide services to folks who have experienced sexual violence and human trafficking to help them heal and seek justice from the violence they've experienced. So sexual assault centers offer a 24-hour helpline. They offer individualized support to folks to help them go through processes they might go through after they've experienced violence, like going to court, making a police interview, going to get a medical exam, defining healing and justice for themselves, connecting them with other survivors, and engaging in support groups. We also do a lot of prevention education about sexual violence and human trafficking. And through MaineSTEN, which is a program of Mi Casa, MaineSTEN stands for Maine Sex Trafficking and Exploitation Network, we support human trafficking providers around the state to help them coordinate services and connect to each other and provide resources for them to use, them and their multidisciplinary teams. And we create outreach materials, training tools, and we host a Maine Human Trafficking Survivors Fund, which provides support. I think in the last year it's provided support to over 100 folks, individual recipients in Maine who have accessed the fund to get needs met, like emergency housing, transportation needs, food, clothing, and immediate needs. And that fund can be accessed by calling the Maine Sexual Assault Helpline or the Maine Domestic Violence Helpline, either one.
Do you happen to have those phone numbers?
Yes, the Maine Sexual Assault Helpline is 1-800-871-7741. And the statewide Domestic Abuse Helpline is 1-866-834-HELP.
Find more information at micasa.org. And if you're in need of help, call 1-800-871-7741. I'm Cindy Campbell. Thanks again for joining us, and stay healthy.
Join us again next weekend for Maine Concerns with your Town Square Media News team.